Friends, on occasion of completing 25 years of SISA services, we have organized this 14th SISA Live Surgery Conference. I am Dr. Raghuveer Reddy, Organizing Secretary. I am joined by Professor Adrian Wilson from UK, Dr. Christian Kill from Germany, and 20 skilled surgeons from India who have participated in our discussions on advanced surgical methods. A major focus of our dialogue has been on preservation of the knee joint, stressing the importance of repairing rather than replacing it, especially for our younger and more active patients. We have highlighted the procedures like high tibial osteotomy, which aims to prolong the life of the partially damaged knee and potentially avoid the need of joint replacement. This conference has brought together over 400 orthopedic surgeons from across India to explore the advanced knee techniques in the re-alignment surgery and related areas. So this conference is being done in association with London Osteotomy Group and with the 20 national faculty. So before going to the surgery topic, we'll go some basics. So we want to make you some little bit first year anatomy of the students. So what we see in the X-ray, it is bone. What we don't see, it is joints. So bone has got a healing capacity. So if we sustain a fracture, what we do, we put a plaster, plate or screws, and the villagers, they do coax treatment. Within 3 months, it will heal. Whereas joint injury doesn't happen with major accident. It happens with mild injury, twisting episodes. Swelling will be there for 1 or 2 months. Afterwards, it will settle. But patient will remain disabled. He can do routine sedentary things, but he won't be doing demanding things. So this is the bone upper end covered by cartilage. This is the meniscus, acts like a shock absorption in 2 bones, and this is the ligament. So ligaments, meniscus, and whole joint is surrounded by a capsule. If any fluid accumulates, the joint will swell. So fracture, it will heal. And to see joint, we have 2 options. One is MRI and arthroscopy. And this is how the cartilage looks on the screen. So soft, viscoelastic. So normally cartilage wear starts from physiological 30, and it is by 70, 80 it gets worn off. But in some stages it gets early. It may be because of injury, overuse, overweight, even genetic. Even thin people also can get arthritis. So we stage mild, moderate, and severe. And these are various surgical methods or non-surgical methods. And these are surgical methods. So what we are going to talk is joint realignment procedures. What is the other end is a replacement. In between we have a ligament, meniscus, cartilage surgery. Even for that, realignment is required. So if the knee is completely damaged, cartilage, then we do total knee replacement. It is partial knee replacement. So these replacements, they last for 20-25 years. So patient comes, age between 40 to 55. So they'll tell, doctor, you are saying replacement after 60, 65, but I am now 40, 55 in between. What to do for next 10 years? Because I am a breadwinner, I have to be active. That comes the realignment joint preservation concept. So normally the weight bearing axis starts from center of hip, the center of knee to ankle. Here in early cases the axis changes. So in high tibial osteotomy, we cut the bone surgically to straighten it, so that some portion of the body weight from the worn-out portion of the joint is transferred to the healthier part, thereby redistributing the forces, thereby pain comes down and function is improved. This is the correction alignment, and we can have a fibrous cartilage growth. This is why we plan this and do a fixation. So these are ideal candidates, usually recommended for mild to moderate arthritis, especially those under 55 years of age, as well as athletes and active older patients. Recovery after osteotomy typically takes 6 to 12 weeks, and most of the individuals, they go back to resume normal activities within 6 months and sports within 12 months. So these advanced surgical techniques, they have got potential to delay, or you can avoid the joint replacement surgery by maintaining the natural knee function. So it is like two things. It can be a stopgap before joint replacement, and sometimes you can avoid it. So what it means is, even if you get 10 to 15 years life, it is good, major benefit to the patient. So there are indications. Every indications, there the patients are there. Some patients they require TKR, some they require partial, some they require HTO. Normally in our society, only they say only PRP or joint replacement. So we are talking about joint preservation. So we have two examples. This patient, you can see the lady, 42 years female, joint is, you can see axis is going here, not in the center. So we did a alignment correction. You see here how she was walking before, 6 weeks later. If you would have left for at least another 5 years, you would have gone for joint replacement. She would have become grandmother. So another case, 60 years male, teacher and farmer. You can see it's bone on bone. So he requires actually ideally joint replacement. But he says, doctor, I want to work. If I do joint replacement, he can't go and do forming. He does forming himself. So you see the axis is going here. So what I did is, I did a realignment surgery. I told him to go for second leg after 2 months, but he has come after 2 years. Some more joint has damaged. So I have to do it higher degree, 2 level surgeries. Now he can do forming for another 10 years. So this is the thing what I want to show about joint preservation. And we'll talk about 2-3 patients, then we'll have question answer session. Madam. Madam, you can stand. Just stand.